Unfortunately, I have experience with today's topic.
You did?
My healthcare costs have gone up tremendously in the last few years, and it is getting to be a pain point for a lot of pastors and their families. So we're going to talk about it today and kind of discuss some things that are occurring with pastors, healthcare costs, and what churches can do to support them. But before we get into the content, we want to thank our sponsor. Tyndale has been a longtime partner of Church Answers. I say sponsor, and they do sponsor a lot of things, and we're grateful for their sponsors. It's really a partnership.
It definitely is a partnership.
We enjoy working with them on any number of things. Look to be doing some research with them coming up soon enough. So I look forward to doing those projects. But they have this great Bible for kids. So are you looking for a Bible for your youth ministry that the students will love reading? Go check out the Go Bible. This is a life-changing Bible for kids, packed with more than 600 focused and fun features, such as a full-color interior, kid-friendly detailed maps, and tales of transformed people from the Bible. The Go Bible brings scripture to life in a fun and engaging way for kids. So this is the New Living Translation, which we love. It's great for children. They've got all sorts of special features in here: know, go, and grow, choose to change, key verse challenges, and factoids, and much more. It's actually perfect for kids ages 7 to 12. That's really the age range here, 7
Right.
to 12. So help kids grow closer to Jesus and understand and apply God's word. Link in the show notes, of course, but kidsgobible.com. That's really easy to remember. Kidsgobible.com. You can check it out at your favorite local bookstore as well.
Good
Thank you,
for
Tyndale.
Tyndale
Thank
for
you, Go Bible.
finding that domain.
I know. It's a great domain. I mean, we do a lot with domains. So kidsgobible.com. Yeah.
Yeah.
Okay. So the annual cost of family health insurance was, the annual cost of family health insurance coverage at work is now around $24,000, up around 7% this year.
And when you say at work, that means employer contribution, I assume, or is that total?
Total.
Okay.
All in total.
Got it.
And while there are some ways to mitigate these expenses, healthcare costs are up much more relative to other goods and services. Since 2000, Dad, the cost of medical care has surged 119%.
Wow.
By comparison, all other consumer goods and services have increased over 85% over the same time frame. So those are the numbers. I went through those quickly. I just want to show facts to demonstrate that, yes, healthcare costs are going up faster than the cost of other things. And we're getting to that pinch.
Just a point here. Churches will have salaried and benefit employees, and they will have some contract employees. We're talking specifically about the pastor, particularly the pastor who has a benefits package. We know that many churches are going to co-vocational, bivocational, and more contract workers, but many of them will keep the full-time compensated, benefited pastor. So this is where we're talking about here.
Yes, this is particular to the full-time employee, but a lot of churches and a lot of our listeners are in this category, and they feel it. Now, in our case, the church pays for me, but not my family. So I have to cover the costs of my family.
Right.
Your church, some churches, although I'd say fewer do this now, but they pay for the whole family.
That used to be somewhat standard, but it has become so costly now that you have fewer and fewer churches that say, oh, we're going to cover the whole family. I can even remember some seminaries that used to do that, Sam, but not anymore. It's all changing, and you're fortunate if they pay for you. Some of the churches pay for a portion of the pastor only and leave the rest to the pastor, much less any family plan.
Yeah. All right. So the typical health cost for insurance for a family is $2,000 a month.
Mm.
That's more than my mortgage, Dad. My healthcare cost. That's right at my figure. I'll just say it out there on the air. That's pretty much in line with what I pay. Just the health insurance part, not other costs. And that's not dental either. Goodness gracious, my kids and their mouths. I
Oh
could be.
gosh! Every time I turn around, one of my grandkids has braces. I mean,
I know. I have to pay for all of that.
oh man, I'm
So,
glad I don't.
okay, let's get to some implications of this. The health of the pastor has a direct impact on the health of the church. So,
Absolutely.
if your pastor is skipping needed health care, it will impact the church.
Hmm.
And be very careful about passing on costs to your pastor, right? Hey, church can't afford this anymore. So we're just going to have you, pastor, pay more. Well, that's, we were paying for the family. Now we're not. We were paying for the full employee. Now we're not. Those are decisions that you need to be careful making because you may end up costing you a whole lot more in the long run if your pastor's health declines.
I maybe I shouldn't mention this because it's only related in a tangential way. Uh, I was looking at Church Answer Central, and a few days ago, pastor was called in by I guess the elders and said, "Look, here's what we're going to have to do. You're going to have to pay for all of your health care. We can't afford it anymore, and we're going to cut your salary. I think they said 30%.
Wow.
Maybe it's 40, but we want you to put in a few more hours beyond the 45 or 50."
I'm getting my resume out.
It didn't end well. It didn't end well.
Yeah, that's just ridiculous.
Yeah,
Um,
it was a lot of passive aggressive going on. They just showed they if they had had any, what is the word I can say on air, but if they had had any integrity about them, the church just would have said, it's not working out. We're going to give you a month or 2 months severance, even if it was the church that was in the wrong. But to do it this way, man. But I'm getting off topic. We're talking about healthcare costs.
yes. Um, but it is one of the more important benefits a church can provide.
Absolutely.
Um, this is something that's very important to staff people, not just your lead pastor, but just about anybody who's full time on your staff. And we all know, I understand that this problem is not unique to pastors. If you are self employed in any way, and you have to pay for your own healthcare insurance, it's a really big deal to you too. So I know that
Absolutely.
there's listeners tuning in that aren't pastors. We certainly realize that this is not unique to pastors. We are just simply addressing the issue through the lens of the church. But I know of plenty of people, Dad, that would take less pay to have healthcare covered
Hmm.
because it's just so expensive right now.
Hey, what is
So
happening with many pastors today, Sam, is churches are saying, here is your lump sum. And from that, you pay your own benefits. And as healthcare costs go up, the church doesn't even have an awareness because they're just giving them a lump sum. And so, if the pastor gets a raise, say of 4%, that's big these days, 4%. But the healthcare is part of what he has to pay for. He loses money because the costs are going to
this is
increase
what
more than that.
I've experienced. My take home is less now because my healthcare costs are up. It's because I have to pay for my family. So,
Hmm.
you get a raise of 3 or 4%, which you're grateful for. And there's plenty of people listening in that would say, I would love a raise of 3 or 4%. That would help out tremendously. I haven't had one in years. But yeah, if healthcare costs went up 7% just last year, most people are not getting 7% raises. So, the corresponding amount that you're making to what you have to pay, it's getting worse. That situation is getting worse.
And most
So
church
let me ask
members
you a
do not realize that many of their pastors are paid that way. So the church member is oblivious to what is going on unless somebody speaks up for the pastor in many
Yeah, and
churches.
that's the way it worked for me until the last couple of years, if I remember right. And thankfully, our personnel committee has really changed some things for the better and done a really good job. And I'm in a I'm in a fine place now. But I had the lump sum package, and then my healthcare costs just kept going up and up and up and up. And finally, they remedied the situation, and to their credit, they did so proactively. So I'm very grateful for that. But not every pastor has a church that even knows, that even understands. So I would say, if you're listening to this, don't be afraid to talk to your elder board, your personnel committee, whoever oversees this. Don't be afraid to just sit down and show them and just say, hey guys, I was paying $15,000 a year for healthcare. Now I'm paying $22,000 a year, and it's getting to the point where I need some help. Don't be
Mm-hmm.
afraid to ask. This was your big issue when you lived in Florida when I was a kid. You just didn't ask, and you had plenty of people that would have stepped up.
Oh, that story is a horrendous story on my part. You boys were getting fed, but that's because we were checking out food at the food closet, and that was the only way.
I love how you say we were checking out food, which
Well, no. You had to sign a clipboard with a piece of paper on it, what you got, and sign your name. We were checking it out.
I remember being excited about peanut butter. I still have memories of that.
It was a big old thing of peanut butter.
I know. I remember getting the big old
We
thing of peanut
ate a
butter.
lot of peanut butter.
to this day, to this day, I eat a spoonful of peanut butter every single day. That's
I
my
love
snack,
peanut
and
butter.
I think it goes back to those big containers of peanut butter
You want some
that we
peanut butter?
that
Yeah,
we
well, that's
checked
all you're
out
gonna
of the
get.
church
Peanut
pantry.
butter.
I wrote an article one time. You don't even know this, but I wrote an article one time for the local paper. This was at a previous church, and they asked me to do a regular column. And so I don't think these things are anywhere online. They were just printed in the local newspaper. And I wrote and if I remember right, it was why my family stole from the church pantry
Oh, I
was
remember that article, Sam. I
was
don't
the
know why. Yeah.
headline. And I told that story. But anyway, so let me
Well,
ask you a
if we were
question.
thieves, we left our evidence behind. We
You
stole
did.
this.
You did. You did. I'm speaking a bit in hyperbole
Yeah.
because it makes for a good story. And we
Mhm.
really were not well off at all. I mean, we as a family, you were struggling to provide during that
Mhm.
time.
Totally, totally and completely.
So should churches? Let's just back way up. Should churches even be doing this? Should they pay healthcare for the employees? Should they pay for the family? Like what should they do?
It depends.
Of course, classic church answers, Rainer on leadership answer.
It really does depend. If you're a church that can afford to pay for health care benefits, in other words, your church is in a position to provide benefits for an employee, absolutely. The church should provide at least for the pastor, at least for the pastor. Now, you get beyond that and talking about family benefits and should you pay that? Again, you have to weigh, you, the church, have to weigh what the overall benefit is to the pastor. Most pastors would greatly appreciate you paying for their family instead of a like amount in income for salary because it has tax implications. So most pastors would like that, but we cannot say every church should do this. We know that many churches are beginning to see financial pinches like they've never had before, and they may not even be able to afford a full-time pastor. So it depends. Now, let me say this. Don't pretend that you are paying someone full-time if you're not. So if you have reduced the salary in order to pay a little bit of health benefits, or you have no health benefits, don't pretend that that pastor's full time. All of a sudden, you've got a part time paid pastor that may be full time, and we see that full time in work hours, and we see that quite often.
If you do not compensate church staff appropriately, then you should change your expectations of them.
Right.
Allow them to get another job. Tell them that they now should work less hours. It is unethical and perhaps
Unbiblical.
illegal, depending on
Mm-hmm.
what you're doing. I mean, there are laws around this. You cannot pay somebody part time and have full time expectations. So I would say, just if your church gets to the point of where we just can't do this anymore, fair enough, churches get there, but you have to change the expectations that you now have placed on the pastor and allow for the pastor to do something else.
A lot of churches aren't willing to do that. That's why we deal with a lot of hurting pastors.
Indeed. Yeah, well, it's a great way to just have the pastor leave.
Mm-hmm.
I
It's
mean,
passive aggressive, that maybe to kick the pastor out, which is unethical in itself. I'm talking about passive aggressive.
indeed. Now, there are ways to reimburse church staff for healthcare costs. And so, without getting all the technicalities, there is the health reimbursement arrangements, HRAs, as they are called. But you do need to know your tax guidelines here. So I'd certainly encourage you to reach out to a professional. We are not tax professionals, so you should not listen to us for tax advice. Uh, but there are ways to compensate, to reimburse, not compensate. But if you do this, just realize when you offer benefits, each full-time staff person on the church has to be offered the same amount. So if you have a full-time assistant and a full-time pastor, you have to offer them the same thing. So just keep that in mind. But if you want to learn more, you should just search it out. Health reimbursement arrangements is what they're called. So you can, this used to be against the law to offer a stipend. And I think it was about 4 or 5 years ago when this changed. And the laws are always changing, which is why if you're listening to this a year after we record it, it's probably good to double check because we are about to get, the administration is going to change. We know that with the election.
Yep.
And
And
with that may come changes as well. So,
well, there's going to be dramatic changes. As I'm speaking with this, it'll either, as of now, it'd be Kamala Harris or it'd be Donald Trump, one of the two.
as of this recording,
As of
we
this
don't
recording, we don't. Yes, things are changing rapidly in the political world, and so either one of those are going to usher in dramatic changes, tax code, benefits. I can start telling you what direction it's going to go according to their platform and which ones I like and which ones I don't. But that's not the purpose of this. This is just simply to say, stay tuned. Things are about to change.
nobody, no administration has resolved the healthcare system.
Right.
It's a gigantic mess. I'll just say that. We don't get overly political on this show for obvious reasons, but it's a problem that has gone unresolved. We'll just say that. And there's been plenty of administrations that could have worked on it, but have yet to fix it. So hopefully that will change in the future.
You want to hear a Medicare gripe?
Sure, Dad. That's what everyone's tuning in for.
Hey, our audience has a lot of me out there. Medicare, of course, what most senior adults like me are on for health care, and my wife. And so we're both on Medicare, and we're blessed enough that we're able to get a Medicare supplement. So, we're insured well between the private supplement and the public Medicare. Well, we got a $8,000 bill in the mail for Medicare. It's like $8,200 to your mother. And basically they said, we weren't charging you enough the last 3 or 4 years, so this is a makeup. We had no idea that she wasn't. We were never notified that she wasn't. And then when I asked them about the future, they said, it's probably going to be short for the future. How much? We can't tell you.
You'll know when you get the bill.
Oh my God. I mean, it was like a 3 or 4 year cumulative bill of shortfall. So that's my gripe.
That's a legitimate gripe. We're going to charge you something. We're just not going to tell you what it is. And there's no way for you to know until we decide.
Yep. That's another story. My age causes me to get off topic so much more. Let's get back on topic.
Well, the last thing that I'll mention is you should really make sure that your employee handbook is up to date. Make sure that you've sought advice from a professional in the healthcare world, because if you haven't, there's likely some things that you are missing. And you don't need to have a mismatch with what you're doing and what your employee handbook says. That's a very dangerous place to be from a legal standpoint.
You really become liable if you do that.
You need to, if you're like, oh my goodness, just update it. These are not bylaws typically. The pastor's benefits package is typically not in the bylaws. I would argue it shouldn't be in the bylaws. That should be in an employee handbook. And policies and procedures are typically changed by an elder board or a committee or something like that. Um, it's a fairly easy thing to do. It's just a matter of reading what you currently have and then making sure that it matches what you're currently doing. And a lot of churches have the mismatch of what they're doing with what's in the employee handbook. So just read it, see what's there, and if you need to change it,
Mm-hmm.
um, and adjust accordingly. But you really don't want to. Something happens to the pastor, a medical issue, whatever that may be, and a claim is made like this is what I should be receiving, and it's different than what's in the handbook, that can put you in a precarious spot from legal liability that you really want to avoid. So just make sure that employee handbook is up to date.
Absolutely. Hey, we want to thank Church Answers University. I got to tell you that Church Answers University is one of the most exciting places that of ministry training that I can think of. Here's the deal, and Church Answers University is one of our co-sponsors for the month of August. Here's the deal with CAU, Church Answers University. It offers a diploma. The difference between a diploma and a degree is something that you get in a typical college or university or seminary. This is not as intensive. It is something that will provide incredible training. It provides 10 courses per diploma. It provides all the textbooks for you. It's one, in fact, it even includes an NLT Bible, 10 textbooks, 10 courses. It is great for your lay people. Sam has used, his church has used CAU for a number of people to be trained. It's also good for many in ministry who may not have formal theological training. And the total cost is usually only $1,500 for 10 courses, and you get a diploma. That diploma is now accredited as a diploma, not again, not as a degree, but it's now accredited diploma. So it is an incredible opportunity. $1,500 is the regular price right now for a very short time. As a result of this sponsorship, we're going to give a $500 scholarship, limited number, because we have limited funds to offer these scholarships. If you want to be one of the first ones, go to CAU for Church Answers University, CAU at churchanswers.com. Grab this and you will have incredible training for ministry from great professors. Obviously, it's at your own pace because it's digital, but it has a lot of information. You can get a general Christian ministry. You can get a worship one. You can get one in leadership. You can get one in women's discipleship. Different ones, but 10 courses, all the books, NLT Bible, and you're going to be trained well. That's Church Answers University. Go to CAU at churchanswers.com.
Or you're going to
and see.
email them. Email.
That's a better way to say it. Yeah, email CAU at churchanswers.com and ask if one of those scholarships is still available. If it is, it's first come, first serve. Once they're gone, we'll just have to say, I'm sorry, it's no longer available. So thank you again for being a part of this podcast. Thank you, Tyndale. Thank you, Church Answers University. Keep coming back. Not only will you get practical information like finances and leadership and all that, you get the incredible interaction of a father-son called Raymond. We'll see you in the next episode.